Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Mansoura University. Let us see the Gynecology Abdominal Examination checklist. Okay? Checklist is very important, as I said in the previous lecture, for the medical students, for undergraduate, postgraduate, doctors, also for all professors of obstetrics and gynecology. So let us start with the first slide for Gynecology Abdominal Examination checklist. First, you should wash your hand with water and soap, or use alcohol. If washing hands is not available, you can use alcohol. Okay? Then introduce yourself to the patient, including your name and role. This is very important. The patient should know. For example, you may say, I am Nader, I am a 6-year medical student, or I am Nader, I am resident in OB/GYN department. Okay? So tell her your name and rule what you are going to do. I was asked to do abdominal examination, if you please. Okay? Then confirm the patient name and date of birth. You should know the name of the patient and respect her very well. Inspection of the patient is very important. If she is not married, you can say Miss, for example, Miss Noha, or if she married, you can say Mrs. Noha, and so on. And the date of birth to know the age of the patient. Okay? Okay. Then briefly explain what the examination will involve using a patient-friendly language, as this reduces the anxiety and enhances cooperation. Okay? Gain consent to proceed with the examination. Provide the patient with the opportunity to pass urine before the examination. Okay? Okay. Prepare equipments that you may need on abdominal examination. Of course, measuring tape is important to measure any mass. Also, stethoscope for auscultation of the abdomen. Then position the patient supine on the clinical examination couch with the head of the bed raised to 15 to 45 degrees. Okay? This is suitable for the patient. Okay? So the patient supine with head elevated, head of the bed raised 15 to 45 degrees. Okay? Okay. Provision of privacy is important, and the curtain in the examination room is needed. Patient is entitled to have a chaperone accompany her, maybe formal or informal. Adequately expose the patient's abdomen for the examination from the pubic symphysis to the xiph sternum. Okay? Okay. And again, you should respect your patient, respect confidentiality, dignity. Okay? Ask the patient if she has any pain before proceeding with the clinical examination. This is very important, really. If she has pain in certain site in the abdomen, this area should be examined last. Okay? Okay. Then position the patient appropriately for abdominal inspection. Stand on the right side of the patient, inspect the abdomen closely for the shape of the abdomen, any abdominal distension, any scar of previous operation, and you should comment on the scar. Is it midline scar, paramedian scar, lower transverse scar, healed by primary intention or secondary intention, any keloid? What is the diameter of the scar? Is there any scar around the umbilicus or the iliac region related to previous laparoscopy, for example? Okay? Linea nigra pigmentation if present, striae, rubra or alba. Hair distribution, is it feminine or masculine? Hair distribution, we know that it is a triangle with base up in case of feminine. It is a triangle with base down and the apex up towards the umbilicus in case of masculine. Of course, this is important for some cases in gynecology, like hirsutism in case of PCOS and different diseases causing increased androgen. Okay? If you can inspect any mass in the abdomen, and what is the site of the mass? Any dilated veins? What about the umbilicus? Is it inverted, flat, everted, shifted downward or upwards? Any sinus in the umbilicus? Any discharge? Any hernia? What about colon sign? Colon sign means poosis or ecchymosis and the subcutaneous fat around the umbilicus and the edema. This poosis or ecchymosis may be related to different problems like cancer, like internal hemorrhage, like ruptured ectopic pregnancy, like rectus sheath hematoma. Okay? So colon sign positive or not, presence of hernia, all sites of hernia should be inspected, any divercation of recti. Then perform palpation and start with the superficial palpation for the 9 region of the abdomen, and the site of pain, keep it, if the patient told you that this site is the most painful, keep it the last area to be examined. Okay, perform superficial palpation for the 9 region for tenderness or mass. Also, don't forget to palpate the inguinal lymph nodes, okay? And comment if it is enlarged, is it firm or soft in consistency, what is the size of the lymph nodes, and so on. Then perform deep palpation of the abdomen across all 9 regions of the abdomen. Palpate the liver and the spleen and the palate, the kidney, palpate the aorta, palpate any abnormal mass in the abdomen, and define its character, starting from its site, size, measured in horizontal line and in vertical line with measuring tape, shape of the mass, if there is tenderness in the mass, what is the consistency, is it firm or cystic or soft, surface smooth or irregular, mobility from side to side and up and down, or there is limited mobility or no mobility. And if you can reach the lower border of the mass, this is very important also to differentiate pelvic-abdominal, like uterine mass, from abdominal mass in ovarian mass. Okay, in ovarian mass I can insinuate my finger below the mass, okay, because it is purely abdominal. So this is called the finger below test. But in case of uterine mass, which is pelvic-abdominal mass, I cannot insinuate my finger below the lower border of the mass. Okay, so finger below test or getting below test, this is a test that can be done during the evaluation of abdominal mass. Okay, so all these criteria should be described if there is abnormal abdominal mass. Okay, then go to percussion, perform hepatic percussion to identify the liver's border, perform splenic percussion, assess shifting dullness for ascites or internal hemorrhage, auscultate the abdomen to assess bowel sounds. Some doctors prefer to do auscultation earlier before palpation. Why? Because sometimes the inguinal motility affected by the palpation, either by depression of the motility or exaggeration of the motility. So they prefer after inspection to do auscultation. Okay, others go in the same order: inspection, palpation, percussion, auscultation. Okay, so what is next? Explain to the patient that the examination is now finished, and you tell her simply defining and answer any question raised by her, and of course cover her abdomen with blanket. Thank the patient for her time and for being cooperative. Wash your hand. Summarize your finding. For example, Mrs. Naha, 28-year-old, second gravida, second para. She has lower abdominal pain, more to the left region and in midline. Okay, 6 months ago, on abdominal examination, there is suprapubic mass measuring 10 by 6 centimeter. The mass on palpation is mobile from side to side but not up and down, and it is firm in consistency and smooth surface, and do not attach it to the underlying skin. Okay, the mass is not tender. Okay, so you describe the mass very well. I cannot insinuate my finger below the lower border of the mass, suggesting that this is a pelvic abdominal swelling related to the uterus. This is mostly uterine mass, most probably uterine fibroid or leiomyoma. Okay, so you are going now to summarize the finding. As I said, this is for example, and you can suggest further assessment, like I wanna do bimanual pelvic examination to differentiate between uterine and ovarian mass, and to confirm that this is a uterine mass, for example. Sometimes you may need to do BR examination to evaluate the broad ligament and uterosacral ligament for irregularity, and so on. So you may need ultrasound, either abdominal or transvaginal. So this is called suggested further assessment. Okay, this is the end of gynecology abdominal examination checklist. I hope it is clear for you. Thank you, everybody. This is my box published on Amazon, textbook of obstetrics, textbook of gynecology, contraception handbook, and the multiple choice question book. And this is my site on Amazon as an author, and my site on YouTube channel, and my site on Blogspot. Okay, see you, bye bye.